hand hygiene station set up here. I'm just waiting for the lift to come back down because someone's just used it to go up to immunology. It's kind of hard to know whether to get in the same lift or not. That's definitely not social distancing, but there's none of that really going on in the hospital. I mean, there's just loads of people and everyone's just walking by each other in the corridors. Nobody's wearing masks. I have my mask, but I suspect I'm going to be given a new one when I get into the ward. But yeah, it's like it's a different space and time in this hospital. Well, this one. I've definitely got anxiety.
Doors opening.
I'm not gonna lie.
Doors closing.
Someone just like ran into the lift. I guess it's fine. I don't know. I've had so many injections and needles and cannulas for 20 plus years, almost 30, and I still have anxiety
Doors
today.
opening. Fourth floor.
What's the anxiety about? I think it's because this is something I haven't wanted to do, and now anyway, look, it's probably not going to be as big of a deal. I normally just suck everything up, and this time I'm a bit dry mouth, heart beating. Anyway, gotta get on with it. Just get in there and start the subcut training and, you know, report later.
Over, then down, across, down, across, down. So I'm not going over the same surface twice, yeah? And then that can just go in your normal household rubbish. And then in your equipment that will be supplied by Lloyd, you're going to have a sterile paper towel. And so if you've got your tray that you've cleaned, you can lay this out. You can touch it, just at the edges.
So I would be wearing gloves for this?
You don't
just
need
you.
to.
Okay.
Yeah, just me. Because it's not completely sterile. That field is sterile, but because I've touched it, I would be taking my gloves off now if it was completely sterile, and we're not doing it like that. Okay, this is just really for you to lay all your equipment out.
Okay.
And then you need to lay out 2 syringes. Do you want me to do it so you can video? And you know these packages, they've got a magic end that you pull open.
Okay.
And then you need 2 needles to draw up with. As you can see, these the small ones on me are too tight, the medium are too big. That's got a what I call a magic end. And then I screw that on.
Okay.
That end is sterile. This end is sterile. There it is. So you don't touch the end of that. They're sterile. And that goes in there. So you put it on tight, but not too tight, because you're going to have to remove that.
Okay.
And then you're going to have the butterfly needles, which are going to go into your abdomen. That's the end that's going to go into your tummy. It's got a cover on it.
Yeah.
wipes. 2 pieces of cotton wool. And then your immunoglobulin. Now I'm pulling this apart, but can you see that little tab on the top?
Mm-hmm.
That unpeels, but you can't do it with gloves on.
Okay.
One. Two. And then if you've made your little bags up, once you get your delivery with 2 of everything like this, you can use your little bag. People use a freezer bag, and you can put all your paper into there so that you can keep everything clean and organised. On your box, there may well be identifiable information on there, so you need to dispose of that so that people obviously can't see it's your medication. I've got a special box that I put those in, so I just put these ones to one side, but you just need to be careful of that. All right, so you've got everything ready for your treatment. So before you start to draw up the immunoglobulin, you need to do some checks on your immunoglobulin. So you need to check that it says Gaminal. It should be a 4 gram vial, 24 mils. You need to check the expiry date to say that it hasn't expired. And you can have mixed batches. So these batches, they don't need to be the same. They can be mixed. And I'm going to give you a special diary sheet to put these labels on in a little while. All right. So you need to just check it hasn't expired, which it hasn't. They're both 2022. And that they both look clear. There's nothing floating in them. And that the tops are intact. They're not been loosened at all. Now I need you to participate, and then you can do a bit of filming when.
Okay, so
yeah, work the, and then when you're ready, go to about 10 mils.
Yeah,
and then pull the end of your cap off.
there's something else you said to remember to do.
And then hold the bottle. Pierce in the middle. And then push the plunger down and keep it pushed down, and then turn the bottle up so the needle goes into the immunoglobulin. That's it, and then let it draw back. It should start to draw back itself, which it is. And now it just needs a little bit of help. And just remember to keep the tip of your syringe in the immunoglobulin. It's alright, take your time. It's quite stiff.
Yeah.
You're doing a very good job. That's it. Well done. And then that's it. Take the vial off. Yeah, it does that little spludge. And then obviously if there's any air, that's it. Perfect. And then recap. And then lay down. Right,
And
we just
these,
stop it.
do these go into the same bin
Is
container?
that stopped? Okay. So you take off the plastic.
Yep.
And that can go in your bin.
So where would the screw top be? In the other one?
Or just in the same place.
Okay.
Okay, and then you take off your needle. Now that goes into your sharp bin,
Got it.
which you'll have next to you. And then you join those up together and screw it in so that it's joined.
Okay.
Then we have to, what we call, if you come over here, is prime the line. So we're going to push the syringe up very gently to fill the tube, and we're going to try and get it to about here. This is quite difficult to see depending on the light, but if you can you see the immunoglobulin going up the tube?
Yeah.
Yeah. You go quite slowly. And that's ready now to give.
So where is it reached?
Just to the end
To
of
the
the,
end of the
yeah.
cap. This-
Now, if it comes out of the top,
Mhm.
don't worry.
Okay.
They just say if the needle's dry, it stings less when it's inserted.
Great.
All right. So now your turn.
No, it is.
Just give the area a nice long wipe just across. That's it, perfect. And you avoid the belly button, so avoid about 5 centimetres around the belly button because you've got a lot of tissue there.
Okay.
Okay, and then just let that dry off. And then remember to hold the butterfly wings together at the top. And the other way.
I can just leave this, right?
Yeah. Hold it with the butter. Yes, that's it. Yeah, and you can just rest that anywhere.
Okay.
And then you take the cap off. And you can give me that, but you can. And then you pinch quite a lot of skin together. Quite a big chunk. Yep. And then, yep. Straight in, go as quick as you can. Well done, brilliant. And yeah, and then you do your little draw back, your little pull back. So pull back on the syringe. Now you're going to push. So pull the plunger back.
Pull the plunger back. Okay. Yes.
And then
So what am I
that's
doing
it.
that for?
That's it. Just that's fine. You would get blood coming out there straight away if there was a problem.
Right. It's for the blood. Okay.
Yeah.
Got it.
And then start to push. And don't worry about any bubbles.
Oh, ow. So do you try to kind of go in different areas through
Yes,
the week?
precisely.
Okay.
Yeah, don't go back to exactly the same spot.
Does it matter where I hold this syringe? Not really.
No, I mean some people, I'll just put this down at the minute. I'll just show you. So some people find it more comfortable putting the end of the plunger into the fatty part of the hand. Well, you haven't got fat on yours, but you see what I mean?
Okay.
And then sometimes if you sit forward, I'll put a pillow under you. So at home, you could rest your arm.
Okay. But the position of the syringe being any type of way
No,
doesn't
it
matter.
doesn't matter. Just comfortable, finding the most comfortable.
Right. So the angle is 45.
Yeah, about
Ish.
45, yeah. The more it goes deeper into the tissue, the less swelling. So if you went too shallow, you would have more swelling. So the deeper the needle goes in, so some patients I've known have gone in at 90 degrees, sort of more or less just gone straight in. So the deeper it goes, the better. Most people do it 45 because it's easy for them to just hold it, you know.
Okay, but 90 is okay as well.
Yeah, you're not going to hit anything.
And what you said that if there is blood, what do you do?
So if you do get blood back into it, we recommend that you take the needle out and then you re-prime the get a new fresh needle from a pack,
Okay.
and reprime it and then go into a slightly different site. But to be honest, it doesn't very often happen, and it wouldn't harm you.
Mm-hmm.
You're doing really well. The time that you shouldn't give your immunoglobulin at home is if you had a fever,
Okay.
or you had signs of a respiratory infection and you hadn't had any treatment. We would say postpone it for a couple of days until you had some antibiotics or the fever subsides,
Okay.
because immunoglobulin can cause an inflammatory response,
Right.
and so sometimes people can feel a bit flu-like after it.
Yeah, I generally do with IVIG.
Yeah. So if you've got signs of infection, just be a little bit more cautious. You're not going to have a terrible adverse reaction to this because it's absorbed very slowly into the bloodstream through all the capillary networks. IV goes straight into the circulation, but this is absorbed very, so you wouldn't get massive adverse reactions, but some people can make them feel a bit more flu-like after. So if you can avoid giving it at the time of a bad infection, then generally after a couple of days of antibiotics, or if you've got no fever, you can give it. Some people have paracetamol and antihistamine before anyway.
Okay. Might be a good idea. And is it generally going to be the same reaction every time?
Yeah. This local, we call that a local reaction. That should start to settle down after about 3 or 4 injections. It should start to feel better. Obviously, because you're putting these large volumes of fluid in, that's why it stings. So that stinging is going to be there, but it should start to feel better once you've done it a few times.
Just because I'm expecting it?
I think because you sort of get used to it, yeah.
Yeah.
And your skin gets used to it. And some people say they don't feel anything after a while. And honestly, I've looked after people who do this at home for 15 years.
They've switched off.
And then, yeah.
The brain cells.
Yeah. They just do it once a week. It takes them about an hour from start to finish. And then they forget about it. But I can't say for you it's going to be the thing that, you know, because you've had such a good experience with your IV immunoglobulin.
Oh, these are maybe people who didn't have good experiences with IV, or they didn't want to.
Or didn't even get the opportunity to have it IV because they've got rubbish veins or. Yeah.
Okay, so.
I add a little bit of blood back on that one, so that might bruise that one. And look, you've got 2 lovely Easter eggs now.
How do I time the tape and the chutney? I suppose I'll just
shut
just
that off.
Doors
go
opening.
open my stuff. And I'm back in the lift. It's a couple hours later. It was alright. Adam work smart. Okay. to this painting so many times coming out of the lifts on my way to scans. And this part is quite raised. And a bit of blood came back out of this one, so presumably it will be a little bit bruised. This one as well. So yeah, when your body is a foreign country, but then it's not, and then it becomes home. So I guess I'll get used to it.